Medurstand. Understanding medicine.
Ladies and gentlemen, welcome to Medurstand. This is the second of the series of interviews on role of artificial intelligence in medicine, in healthcare in general and in medicine in particular. We are very lucky to have Dr. Sohail Chughtai from UK, who is an orthopedic surgeon but has got a lot of experience in IT, particularly in innovation of application of IT in medicine. So, Dr. Chughtai, welcome to my channel again.
Thank you very much, Professor Aziz Rehman.
In the last episode, we discussed in general what is AI and what is its role in healthcare. And you told us there's a lot of potential, and we decided to discuss its role in diagnostics in this episode. So first, before we go into the details of individual components, can you tell us an overall role of artificial intelligence in diagnostics in healthcare?
It's a very exciting topic. Artificial intelligence has revolutionized the face of medical diagnostics. Where do I start from? Let me start from history taking. You know, the human memory, no matter how much intelligent we become, we have a limited working memory. 3 to 5, for example, 5 or 4 objects, one time we have available to make a quick decision. Now imagine if the working memory barrier is completely alleviated. Like a human brain knows a lot of things, but what can be deployed at one moment is 3 to 5 working memory. But if that barrier is broken, that means a lot of information, which is proven, is available for influencing a decision based on what information is given. So if we take history of the patient through an artificial intelligent chatbot, like a virtual nurse. So the nurse is asking the patient different questions. Abdominal pain, a 40-year-old person with some vomiting, nausea, and a past history of hospitalization 2 years ago with back pain. Now the relation between the two for a human brain could be a quick, requires a recall, and whatever comes to my mind, I'll connect the two. But imagine if the recall has no limit. Like what we learn in medical college, what we learn in house job, what we learn in practice, all of that is available to interpret that connection. So it's more refined way of human thinking. That is one role of artificial intelligence in history taking. Extending the memory is like a third person in the room. If you are with a patient and you're using artificial intelligence, there are 3 people in the room. You, patient, and the virtual nurse. It's a great companion.
If I understood correctly, that means there is role of artificial intelligence on bedside also, when the diagnosis on the bedside.
I think this can apply. The chatbots are very neat. They are embedded in your mobile phone in small devices, which can listen the conversation between the patient and the doctor, and preparing a history summarization. That is what ChatGPT, the large language model, is doing it. They are listening to conversation, they are summarizing that into a neat bullet point. So me and patient have 5 minutes of conversation, and the ChatGPT model, the large language model, is listening. There is a software by the company called Nuance. Nuance is an American company. They make human voice detection software, and they have a medical component. So they are doing the same thing. They are summarizing doctor-patient conversation of 5 minutes into the neat points of 1 minute. They can be put in the medical records. So your point is right. Yes, human bedside conversation can be very neatly summed up into a meaningful chat.
I guess a patient can make some differential diagnosis before even visiting a doctor, because patient will also have access to artificial intelligence.
That comes to the questionnaires you send to the patient before they come to clinic. I do that in my practice. Patients fill a form before they come to my clinic, which gives me 2 advantages. In fact, 3. First advantage is that the patient knows what questions the doctor would have asked me They develop a trust level. The doctor is really interested, is deep down into my problem. After that, I get a neat amount of data, which I would have spent time, or my office would have spent time in collecting. So we can see, let's say, three or four more patients in the morning rather than a fixed number because the data has been collected. The third thing is very important, that this information is now stored and formatted and available for me with suggestions of the computer. Computer can say it's a differential diagnosis, shoulder pain in a 10 years old person, sudden notonicity of trauma, following tumors can happen. It's not saying that this patient has chondrosarcoma. It is pointing my attention towards it so that I don't miss that possibility. So I find this a blessing.
Right. So we clinicians, we use two types of diagnostics. One is the laboratory, the other is imaging. And I would like to know what role artificial intelligence can play in the interpretation of imaging, like an ultrasound, ECG, X-ray, CT scan, and MRI. These are all very sophisticated investigation, and we need highly trained personnel. And if artificial intelligence can help us there, what is the scope of AI in that area?
Professor Aziz, this is an area where artificial intelligence is you can't just end this conversation if you start talking about it. But I'll try and sum up, and keeping in mind the time. The technology of object detection in artificial intelligence has matured over the last 10 years. We have come to a point where human eye can detect 10 shades of gray.
Hmm.
The artificial intelligence can detect much more shades of gray than we can. I'll give you an example of T1 and T2 images in MRI scan. I presume that this conversation is being listened by medical professionals.
Yeah, that's right.
So MRI scan has T1 where the water content is dark. The more the water, the darker it is. In T2 images, the more the white, the more the water content. So, but there is a gray area as well, that before it becomes completely dark or completely white, there is a shade before that. Lightly dark, very lightly dark, gray and less dark. So all these gradations indicate water content, amount of water content. Now let's imagine that MRI scan is picking up the information from the patient's tissues and then storing it onto the hard drive. But before it stores, there is a neural network of artificial intelligence. We place it there, deep learning network.
Right.
That interprets that grayscale and tells us how much water content percentage-wise could be there, which human eye cannot detect.
Right. So though I've understood correctly that because of the increased sensitivity, the AI-enabled equipment will be able to see or pick up certain abnormalities which human eyes cannot. Is that right?
Absolutely. The information is there, but human eye is not capable to detect or differentiate two grayscales, which are very close by.
Yeah.
But artificial intelligence is picking and then interpreting that. It's not just picking, it's the interpretation that if it is 90% dark, 10% gray, what will that mean? If it's 95% dark, what will that mean? So eventually what the report comes out towards while the scan is finished, before the patient walks out of the room, the report is ready. Imagine
Right.
the speed. So it's not only the accuracy, not only the quality, the time saving is of huge interest to medical professionals.
I think that is one of the great advantages because time is money, and especially when we are treating serious patient with stroke, we want diagnosis immediately. And if AI enabled equipment can give us quicker diagnosis, that can of course translate into better outcomes.
That is where we're going. The same goes for pathology images. Imagine that a cell or cell carcinoma or Reed-Sternberg cell, what looks like that. There could be 10 different image variations. So what is closer to that, we probably may not be able to detect unless we sit down for hours and hours on the slide and see it again and again. Computer can tell us that which is the closest model of Reed-Sternberg cell or cancer or cell carcinoma. So pathologists and radiologists, These two branches have a lot of assistance available to the point where the threat is available. There is a threatening kind of atmosphere. That will the pathologists be required? I think they will be, because eventually someone has to take responsibility that I diagnose this condition as tumor. You cannot have computers saying, look, this is tumor. There has to be a human verification.
Okay, right. So I think coming to now another field, we have some wearable devices with the people who are prone to develop atrial fibrillation or ventricular tachycardia, and they are at risk of sudden death. And if that arrhythmia is detected well in time, that can translate into immediate treatment and I think better life expectancy. What do you think which role AI can play in this early detection of arrhythmias with wearable devices, etc.?
You know, the Apple Watch, Fitbits, they all collect information like pulse oximeter readings, heart rate, blood pressure, breathing rate, your activity level, your sleep patterns. Individually, all this information are they are predictors for medical conditions, individually. Like we know that if heart rate has jumps, ectopics, what will that mean for atrial fibrillation? But what about combining that with the breathing rate at that moment? What about combining that with the sleep? What about combining that with a drop in blood pressure, decompensation? Put all together, human brain may not be able to do, is not capable to really make models of susceptibility. That who is more vulnerable, who is less vulnerable. Now, AI will collect all the information, will churn it, and will form a model of susceptibility. That this model from 0 to 3, very small risk, you can ignore, just give a warning. From 4 to 6, you need to inform the patient to change the lifestyle. From 7 to 10, susceptibility model, you need to do pre-screening, 24-hour ECG monitoring, etc., etc. Now, imagine how much lives we can save as doctors if we pick up the most vulnerables and if we let the other people go and be advised. We will decrease our workload, we will decrease individually our workload and nationally the nation's workload. Because if you can pick up the susceptible people, we can treat them early, and wherever the state is providing care, for example in the UK, the state will benefit because the less number of hospital patients, state pays for that, NHS pays for the patients. So this is a huge beneficial industry, $30 trillion industry, and healthcare is artificial intelligence, and 90% of that industry is healthcare. Out of $30 trillion, 19% is healthcare-oriented industry. It includes many things like patient experience, diagnostics, therapeutics, robotics, anything. So you are touching a very exciting zone, and I'm glad, Professor Aziz, that you are motivating, inspiring people to take up and understand the value of this. People who've learned this the traditional way, they have to unlearn the traditional way, and that is a difficult part of learning. Unlearning and relearning is the most difficult part of this.
Will AI be able to interpret a biopsy report?
Well, data analysis is the AI's most delicious food. You know, the deep learning and then the machine learning, they love data. They survive on data. They thrive on data. You give them the data, they will make so much bits of that, analyze it deeply in the way that if you present 20 different datas with different same meanings, they will find the difference between them. That what was the actual difference which humans missed. So an ECG, a biopsy report, is a form of a data. Now that data can be interpreted for mistakes. That it could be wrong. If you attach an image and data together, ChatGPT can say, look, the image provides this information which you have not included or not considered in your biopsy report. So yes, the answer is yes.
Whose job you think is most threatened? A clinician's, a radiologist, a nurse, or a pathologist with AI? Or nobody's?
Frankly speaking, doctors who are in touch with the current technology, they don't have any threat. In fact, they will thrive because the patients are learning to. Remember the fact that the patients are learning to. Nowadays, a person may not be educated, but they have a mobile phone. So their education is not on degrees, not on qualifications. Their education is based on awareness. What is current? So they're very well aware. They can use the apps. They know what to touch and what will come. So they're educated. I call them educated now. They don't have degrees, but they're educated. They can challenge the doctor's opinion. So that is where the trouble starts, and that's where the benefit starts too. Now you can explain and emphasize what is important to a patient, they will perceive it. That's the good part. The bad part is doctors now have to explain. Whereas the doctor was like a semi-prophet before. The doctor said, no more the doctor said. Doctor has to explain what he said. At this point of time, if a doctor's job is replaceable only because he's not current. I'll give you one example. A good quality image presented to a computer, great report will come out. But can the computer take responsibility of a report? Let's say it's wrong. Who will be blamed? A computer? So in that case, a doctor has to come on board and confirm that, affirm, yes, it matches my knowledge. That is where a doctor takes responsibility and then goes to the patient to break the bad news or the good news. The computer cannot do that. So that empathy, that knowledge, the good thing is that the time will be saved. Doctor can spend more time with the patient empathizing rather than learning, spending hours and hours finding what the cancer is. But now doctors have time to empathize with the patient. So in my way, I think doctor's job is not replaceable, nurse job is not replaceable, as long as they are staying in touch with the technology.
With that note, I think it's time to conclude, and we are very, very delighted to hear from you. And ladies and gentlemen, thank you for joining us, and we look forward to see you in our next episode.
Thank you, Professor Aziz. Thank you.